The numbers are actually quite astonishingly high. The NCPCR, which is the country's apex body for child protection, recently in the Supreme Court published the data that they have, and they've said that children who've lost both parents is somewhere in the region of 1,740, and about 7,500 children have lost at least one parent. I'm going to hazard that, this is data that they have. This is data from the end of May. And I'm going to guess that this is not, the full extent of it. This is difficult data to collect. We've been collecting COVID death data, but that was never really geared to also check for all of this other stuff, and that's something that I think systems are only now beginning to look at. We don't have very strong child protection systems at the community level, which is where, this data has to be gathered. So I'm going to guess that we're going to see these numbers rising up. But even as it is, even just these numbers alone, happening as they do in such a short span of time, are quite shocking, quite terrifying, in fact.
Because the numbers, I understand, were already gathering pace before the second wave. What happens to these children in the short term, as you point out, if the systems at a regional level are not strong?
Well, right, even though we've been caught on the wrong foot, I think systems, people are sort of rushing in to fix this. There's been district task forces that have been announced. It's happening slowly. The Supreme Court has taken note of it, so one is hopeful that this is going to mean that things are expedited. The fact of the matter is that children get taken in by extended family and, or the single surviving parent. The imperative thing for us to do is to be able to support those people to look after these extra mouths to feed. So it's not that all of these children are going to have to enter state protection or are going to have to be given up for adoption. Because in India, we have joint families. Families are going to be taking these children in. The important thing is going to be for poor families, these extra 2 or 3 mouths to feed, could be very, very difficult for them to do. So I think what the effort is going to have to be is like kinship care, supporting kinship care, is having foster care kind of systems that allow for extended family to be able to take these children in and receive some support from the state so that children can remain with family in community, and not lose everything all at once.
Yes, because we have seen so much evidence when families are facing dire financial straits that awful things can happen. Children can be, trafficked, they can be forced into labour. That must be something that there is great concern about.
That's always a concern, India unfortunately has the dubious distinction of having been a global leader even prior to COVID on many of these things, on child marriage, on child labor. And you're absolutely right, families, who are forced to the brink of sort of desperation, as families are right now, their adaptive strategies are not necessarily always in children's best interest. And, then they're forced to take dire measures. So I think the important thing is really going to be for the government to ensure that we first identify all of these families and then are able to support them. And I think, I think there's enough attention, and I think, with the courts and all of the state governments having taken note of this, I'm hopeful that we're going to see something good emerge for children very soon.
Atiya, India is, as you point out, a country that is wonderful in terms of the extended family, and family is such a strong bond for so many. It is not an easy country for adoption, and for good reason, because it has been caught wanting along the way, but it is now very difficult to adopt. Will there be an effort to perhaps simplify the process if there are children that simply do not have family to look after them and may get completely lost in the system?
I'm sure that, I'm sure governments are going to have to look at all of these things. I'm not sure, though, that, because in terms of adoption, I think the statistics tell us that it's only children who are very little, infants, who actually get adopted. And, maybe when it comes to that, the country might look at making some amendments, but that's not going to be the large bulk of children. Children over the age of 4 and 5 have an awfully difficult time being adopted anyway. And so those are the children, and I think that's going to be the vast majority of children that we're talking about, those children are not benefited from the adoption system anyway. So really for a country like ours, focusing on foster care and kinship care and those kinds of things is very, very important, actually for sort of the nuts and bolts of a child protection system.
Give us a sense, just finally though, as to the struggle of the country dealing with this massive pandemic. Even though it's on the decline, the numbers are still huge. Is there the money to go around? Are there the systems that do you think will come in very quickly for support in this area?
Well, we're hearing announcements from both the centre and state governments about these large sort of relief packages that they're going to give to families. It is obviously what's important is to see how that actually plays out on the ground. Because like I said, I think the one thing that COVID has shown us in our country particularly is that we haven't spent enough on building strong systems at the community level. And I think that is something that people have realized. And in the healthcare setup, we're seeing how those efforts are being ramped up, and one is hopeful that the same will happen in other systems. From all accounts, there is the money. It's just a question of figuring out the coordination and the logistics of getting it to that child who's in need.
Really?
And I'm hoping we're able to do it.
Yes, I do think that is a fervent hope for all of us. Great to talk. Thanks for joining us.
Thanks so much.